Hi, I'm Dr. Marvin Berlin, and we are catapulting at McKinneyDentist.com down in McKinney, Texas. Whether you know me or not, I want to introduce myself and let you know I'm considered the Godfather of Yes. And what Yes is our practice philosophy here at McKinneyDentist.com. And what it involves is listening to our patients. And when we listen to our patients and they're asking us questions, and what we found out too is they don't like to be told no. And so with that in mind, when patients are asking us things like, hey, can I have my teeth cleaned? Or can I get sedated? Or do you do root canals? Any question you have, we like to be able to say yes. Now back in 2008, 2009, right at the very beginning of 2009, we had a vision, and our vision was we wanted to catapult to a whole nother level. We had the chance to work with Heartland and Heartland Dental Care, and they had a vision too that was preparing to catapult the company. We joined forces, and it's been just an amazing ride up. As you can see on this graph, it's amazing what has happened these last few years, and we're proud to be a part of it. We knew we had something pretty special in McKinney, but more importantly, we knew that if we joined with Heartland, it would be even special, and the company and ourselves and our practice would grow to leaps and bounds. We're glad to be a part of this, and I'm glad you're a part of it as well. For those of you who weren't aware, or even if you were, McKinneyDentist.com started in the early 2000s, and we were a good practice. We were 4 doctors. We were a $4 million practice, but we were pretty unorganized. We didn't get along real well, and there wasn't a lot of growth occurring. And something major happened. We brought in my best friend and partner, Dr. Jeff Lynch. He joined Dr. Matthew Markham and myself, and we started McKinneyDentist.com. We took that $4 million practice, implemented our Yes philosophy, and in a short amount of time, just several years, turned it into a $10 million practice. And it was an amazing run. It really went from good to great, and we were excited about it. I get asked a lot, how do you implement a Yes philosophy in a practice like that? And it really came down to one simple philosophy. That was a yellow notepad, a yellow legal notepad. And what we did is we took that yellow notepad and we said, okay, to anybody answering the phone, I want you to, any question that any patient asks or any potential patient asks, if they ask a question, write it down. If it's not something that we're currently doing, I want to know about it. And whether it's a patient on the phone, whether it's an email, whether it's in hygiene or in an operatory, if a patient is requesting something, we started taking notes and we started saying, which of these items are we saying yes to and which ones are we saying no to? And in our team meetings and our staff meetings, we said, you know what, let's figure out a way to say yes to these patients. Again, patients don't like hearing the word no. They want to be taken care of, okay? When we talk about customer service, what is customer service? It's serving the customer. And it really starts with that very first time when they ask, hey, can I get my teeth cleaned? Okay? Or can I get my sedated? Can I have a root canal, wisdom teeth? Whatever the procedure may be or whatever the patient's asking, this is our chance for us to say yes. And it starts with that yellow notepad. You know, with talking to our patients, hundreds of patients, no, thousands of patients, one of the things we're realizing is that they don't always want what's the cheapest, okay? Sometimes we tend to offer, hey, what's the cheapest just so they'll accept treatment. And that's not always the case, you know. Patients want it done, they want it done right, and they usually want it done today. But when we make something, let's say we're making a crown, patients are wanting these crowns to look good. We are in a very cosmetically driven environment right now, which is a great thing. And so in our practice, we have moved our crowns to almost 100% EMAX. EMAX is a solid porcelain where we can put it in the anterior, of course, and we can also put it in the posterior. You know, patients were asking us, hey, doc, can you get rid of that dark line? I'm seeing a black line around my crowns, or they look kind of gray, or they look opaque. They don't look real. They look like chiclets. You know, we heard this over and over again. And again, when we hear this, we think, well, how can we say yes? How can we make all of our crowns look like real teeth? And the answer for us is EMAX. EMAX porcelain has just been amazing. And I highly recommend you use it in your practice. Every day we start with our catapult pulled way back. Remember, it's not how you start your day, it's how you finish. And so in the mornings when you're in your team meetings and your huddles, this is where we look at our schedule. We're looking for opportunity time. We're looking for times to say yes. So when a patient's in hygiene and they need some treatment, we have the option. We'll know ahead of time, hey, we can work you in at 10 o'clock, 2 o'clock, you know, whenever that time may be. And that's a critical part of this. Have you ever realized how easy it would be to work in 2 crowns a day? Now, you've already got them diagnosed. You know, in our yes-based practice, we do full diagnose. We diagnose the entire mouth. Then we typically present our treatment in quadrants, maybe even half the mouth, and that's a critical part, but it allows us, if we need to work during the day, the work is already diagnosed. So I'm asking you, when you're seeing your patients, at the end of every hygiene exam, how about, let's say, would you like to do that today? I like to finish every hygiene exam with that phrase. Mrs. Jones, would you see that tooth up on the screen? We've got a picture of it. Would you like to take care of that today? And it's amazing how many times they say yes. And that's when we really smile a lot. So I'm asking you, are you embracing yes? It's critical. You know, are you doing it every day? How about every hour? Okay. Even more so, why don't we embrace it on every patient? That's the key to this. And it all boils down to listening. And I just got back from Bell Leadership, and what an amazing time that was. And I learned a lot at Bell. And the main thing that I saw that every leader, every quality that every leader wants to improve upon is listening. And when you listen to your patients, you can hear them ask questions and understand what they're really wanting, and it gives you the opportunity to say yes. It's the same with emergency dentistry, and this is probably the area of dentistry where you can catapult your practice more than ever, because you get someone out of pain, you're going to be their dentist for life. And we have a mantra at McKinneyDentist.com that if a patient calls with any kind of emergency, the response is, how soon can you get here? And it's a critical response, and we really mean it. And if that patient says, I'm on my way, we'll find any way possible to take care of them, no matter what time of the day it is, whether it's during lunch or if it's early, we're going to take care of them. Because with the skills that we learned with Heartland, and Heartland has showed us so many good things, especially with root canals and buildups and crowns. And with that procedure, the root canal buildup and crown, and especially for those of you that have gone in and worked with Dr. Bruder and does his endodontic training, which I highly recommend, we can do the root canal buildup and crown in one setting. And this is an area that's a huge practice builder, and your patients are really going to appreciate it. And this is what it's truly all about. That's another key to lifetime dentistry. You know, this is some amazing times at Heartland, and the vision that Heartland Dental Care is providing for us and the growth that we've seen is just incredible. We're excited to be a part of it. When you combine the yes philosophy, the same-day treatment philosophy, accelerate with Dr. Hodge, learning what we've learned at the aesthetic continuum, endodontics with Dr. Bruder, Heartland has created an incredible foundation for us to build our practice upon. And I'm excited to be a part of it, and I hope you're excited as well. Hey, and I look forward to seeing you in the catapult. Have you ever realized how easy it would be to add in 2 crowns a day, work in 2 crowns a day? Why did I repeat that? Do your hands again. I suck. You know, patients, okay, Mike, I'm gonna just go throw up. I'm gonna have to just at least buy film. Hold on. Well, for those of you, good practice, good practice, good practice, good practice. That's not what I wanted to say. I gotta start over. That didn't flow well. Yeah. Procedure in life, and I just screwed that up for the last second. When we're, God bless it. Just wave your hand. I don't like that. Let me do it one more time. This is, God, man. This is what we've termed Marvin sucks.